The COVID-19 fight in Africa and the growing threat of a continental third wave. The World Health Organization says that test positivity has risen in 14 African nations in 1 week, with 8 countries reporting a 30% spike in new COVID cases. And amid these surges, the World Health Organization says that COVID vaccine shipments in Africa have come to a, quote, near halt. Earlier today, we spoke to Dr. Nkengasong, who's leading Africa's pandemic response as the director of the Africa Centers for Disease Control and Prevention.
Thank you so much for joining us. The World Health Organization Regional Director in Africa said recently the threat of a third wave in Africa is real and rising. South Africa, which recently saw a 60% spike in cases, appears to already be in that next wave. How serious is this threat, particularly if vaccination rates don't change?
It is a threat, and it is a reality of pandemics that unless and until we deploy vaccines at speed and at scale, we'll continue to see waves upon waves coming and going, because the only tools we have in our disposition now are public health measures. And the public health measures are not enough to suppress a pandemic of this size and sustain it at a low level.
President Biden announced this week that the U.S. will give approximately 5 million vaccines to Africa this month for a population of over 1 billion people. It's part of the rollout of the first 25 million doses the U.S. will distribute globally. Is that anywhere close to what these countries need right now?
No, first of all, we are very appreciative of the very good gesture from President Biden to allocate about 5 million doses of vaccines to the continent. Look, we are at war, and at war, you go to war with what you have and not what you need. So we see those 5 million doses as saving 5 million lives. And we also believe that it is a start, the beginning of a journey of strong collaboration and partnership to eradicate COVID on the continent.
And as the U.S. prepares to send those doses of the vaccine to the continent, what is the message that the U.S. needs to hear right now from your region?
Our region is saying that our target is to immunize at least 60% of our population by 2022, so that we can achieve herd immunity. And this is a continent of 1.2 billion people. But as we speak today, less than 2% of our population has been immunized. So my message to President Biden and other partners across the world that cared about working with Africa and consider this as a global threat is that we need to do this with speed, and we need to do this at scale.
And what conversations have you had with world leaders and health officials about the help that they can provide to African countries?
No, we are beginning to see a very encouraging movement in the right direction, meaning the redistribution of doses, especially from countries that already have excess doses of vaccines. We were very encouraged to see that some European countries like France, Germany, and others were making the same goodwill gestures.
And you mentioned that 2% of the population has been vaccinated. What would you say are some of the biggest hurdles that the region is facing?
There are 2 challenges that the region are facing. One is access to vaccines. As you recall, through the COVAX facilities, a few months ago, several countries in Africa were giving the first doses of the AstraZeneca vaccines. And many countries have used those vaccines, and they don't know when the second doses will arrive because of the unfortunate, devastating situation we are seeing in India. Second is the capacity and capabilities to roll out vaccines quickly, which means that we need to build the right partnerships. We are dealing with a virus that spreads very quickly, a virus that is continuing to mutate and generate variants. And the only way to stop the occurrence of variants is to vaccinate at speed and at scale.
And on that same note, let's talk about the variants. The World Health Organization and African CDC launched a network of labs to boost the continent's ability to detect variants last year. But those efforts have reportedly stalled because of lack of funding and staff. How would you describe the ability to test for variants found in Africa and what more is needed?
No, absolutely. That's a very good question. Together with the WHO regional office in Afro, we launched a network, a pathogen genomic network, which I must say that it has done extremely well in terms of connecting countries that do not have the capacity and linking them up to laboratories that do have the appropriate capacity to test, and then also analyzing that data. We at Africa CDC have been able to move around close to 10,000 biologic specimens. We've been able to support them and enable them to sequence at least 13,000 genomes. So I think we have a long way to go, but we have the right systems in place.
And finally, Doctor, across the United States, we're seeing all kinds of vaccine incentives, like the Vax-A-Million lottery or chances to win airline flights or even free college tuition just for getting a vaccine that's free and widely available in this country. How does that land with people across the continent who are desperate to get more vaccines?
I think that is a key word. We are desperate to get more vaccines, and we can see that the continent is eager to get more vaccines, to get vaccinated. There is really an eagerness on the continent for people to get vaccinated. So it is not what we are seeing, of course, on the continent. We have not even started vaccinating to be actually very practical. So we are watching what is going on in the US with total amazement. And we really hope that the partnership with the President Biden will help us and enable us to roll out our vaccines acquisition and vaccination in a timely fashion.
Absolutely. Well, Dr. Nkengasong, thank you so much for your time and best of luck to you with your work there. Thank you.
Thank you for the opportunity.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.